Hi, everybody. I was speaking recently with an endocrinologist who was sharing with me how he manages his patients with type 1 diabetes. And he said that he takes his population, he prescribes most of them, the highest risk ones at least, a Dexcom continuous glucose monitor. He found that that's the best way to manage the population. The challenge is that the data from the Dexcom CGM, continuous glucose monitor, doesn't actually make it into the Epic clinical workflow for his health system. So what he does is he asks the patient to go into Dexcom's app, and they have a sharing function for friends and family, and add his email address. And then at the end of the day, after he's worked the whole day, whole caseload, he goes home, he pulls up his personal computer, he logs into Dexcom, he pulls up his work laptop, pulls up Epic, and he reads through all of his patients' blood glucose readings, and then enters in patient notes into Epic in terms of what they need to do, what they need to be thinking about, and what he can follow up on them with. And that is how he manages his type 1 diabetic population in 2019. And the challenge is that, first of all, it's not scalable. It's not scalable for him. It's not scalable for his care team. There's nothing he can actually take back to his health system and get help with. And it's also not scalable across the enterprise. There's no way for this to actually be something that works. And the sad truth is that this is the reality of what it is like to be a physician in 2019 in the United States, where it's just click, click, click all the time in the clinical workflow, and there's nothing really that they can do to get out of it. And in fact, we're at a situation where an estimated 100,000 physicians who are currently, or future physicians who are currently in medical school, are expected to not practice medicine full-time once they graduate, because they don't want to be in this situation where they're just doing process for process sake and clicking the mouse all the time. This is where we are. And the stark reality is that the US is estimated to face a shortage of up to 95,000 physicians by 2025 because of this. In fact, Mercer estimates that across all of healthcare, we're expected to see a shortage of about 680,000 healthcare workers by 2025. And half of those are home health workers. If you combine that with the fact that we have 80% of US seniors have more than one chronic condition, and according to AARP, 2/3 of all Americans who've ever lived to be 65 or older are alive today. I'm going to say that again because it's a really interesting statistic. 2/3 of all Americans who've ever been alive are alive today. We have a pretty stark reality that this picture paints, which is we have a growing, sicker, aging population, and we have a declining healthcare workforce. And the only way that we can possibly bring these two together to create some sort of healthcare system that makes sense is by bringing technology to patients and providers that changes the dynamic, introduce a new framework where they can actually have a different kind of conversation. And that is, in large part, what my company is working to help with. So Validic connects people with care providers through data that they collect in their everyday lives for the purposes of making patient care better and making the provider experience more efficient. So I've shared with you what it's like for an endocrinologist on a day-to-day basis. I'd also like to share with you a little bit about what it's like for a patient living with diabetes today.
Those early days, I would say I hate my life. And I really meant that. You know, I didn't see me getting any better. I didn't see a future. And you're trying to understand what's going on with you, but you don't know what's going on. You just know that you have this thing called diabetes.
For him to not be able to be his whole self was hard. Diabetes doesn't only affect the person that has it. Everyone around them is affected, and the people who love them are affected.
I worked real hard to capture my data, my blood sugar. I chart it, and I bring that information into my endocrinologist. He wouldn't do anything with that information.
So this gentleman's name is Steve, and diabetes was controlling Steve's life. You heard it from him. He really hated his life. And the challenge that Steve had is that he would go to his endocrinologist on his quarterly basis. He'd get his A1C checks, and the doctor would say, "Steve, you need to eat healthier." And he'd say, "I am." He'd say, "Steve, you need to exercise more." And he'd say, "I am." He'd say, "Steve, you need to track your glucose readings more often. He said, I am. I'm doing all the things you're asking me to do. And so Steve said, listen, you're asking me to track my glucose. Look at my app. Look at my readings. The doctor said, I actually don't have a way of using that information. I can't trust the data. But I do know that your A1C is telling me that you're failing. And this is what Steve was battling with for over a decade. He had uncontrolled diabetes. He hated his life. He became depressed. He actually had to quit his full-time job because he didn't have the energy to make it through a full day. He had to go down to half-time work, which was really demoralizing in an already demoralized situation. And this is the unfortunate reality of what it's like to live with a chronic disease in the United States today. It's actually what it's like to live, frankly, just trying to be healthy in the United States today, because really, to the US healthcare system as it is today, we only truly matter when we're acutely sick. And if you think about the challenge for Steve, what he really wanted to do was get help to be better. He was trying everything he could. So Steve left that endocrinologist, and he actually went to a different endocrinologist that happened to be rolling out a program that Validic was proud to be a part of, and it was actually the same endocrinologist that I mentioned at the top of the session. And the good news is that Steve got better. And what happened? Steve was immediately enrolled into a program where the glucose readings that he was already tracking were brought into the clinical workflow. In addition, for this program, they asked him to connect a blood pressure monitor, step on a weight scale once a day, log his food in a nutrition app, and then also wear a wearable tracker. And his data was going into the clinical workflow. And Steve was thrilled. He was like, first and foremost, before any health changes were made, I was just happy because I was an engaged patient. Like, I knew that someone was going to be looking at my data. That was exciting for me. What he didn't expect was that 2 weeks into the program, one of the care team members called Steve and said, hey, how are things going? Because there's something up that's going on between 7 and 9 p.m. at night. Steve said, what are you talking about? She said, well, your glucose levels are spiking, but you're not logging any data. He's like, I'm not doing anything. I mean, my kids are in college. My wife and I discovered Netflix. We're watching movies on the couch. You know, we're munching on some popcorn. And she said, wait a minute, popcorn? He said, yeah, you know, it's like this bag of, you know, it's healthy though. It's no butter, no salt. It's, you know, it's calorie-free, fat-free popcorn. She said, Steve, that metabolizes into sugar in your body. Like, that popcorn is causing a problem. And he had no idea, so he cut that out. And within 30 days, his A1C dropped by 0.5 point. And it was the first time he'd ever made a behavioral change, and he saw that his actions could actually meaningfully impact his healthcare. And it completely changed Steve's life. And the thing that really ultimately changed it was the data. The data changed the conversation, allowed them to have a different way of speaking. And this is not unique to Steve. So Dr. Aaron Neinstein, who's a friend of mine at UCSF, wrote an article back in February on CNBC. It's a pretty audacious title. By 2025, a lot more people will be tracking their blood sugar, predicts the doctor. Here's why. Dr. Neinstein actually thinks that all of us, regardless of if we have diabetes, will at some point track our blood glucose. And in the article, he highlights a 70-year-old diabetic patient that he has, who also has heart disease, who's a model patient in almost every way. He takes his metformin religiously, he exercises, he says he eats healthy, but Dr. Neinstein said, listen, I need you to examine your diet because I'm telling you your numbers are not right. And the patient said, my diet is fine. And so Dr. Neinstein asked the patient to wear a continuous glucose monitor, and within a week, the patient found the problem. With using his own data from the continuous glucose monitor with no intervention or discussion with Dr. Neinstein at all, he looked at the data and saw the problem, and he said, oh, there's the problem. At 8 a.m. every morning, my blood sugar's spiking. And not only that, he said, that's when I have my banana and orange juice. So he cut that out, and his blood sugar levels returned to normal. Again, no intervention from Dr. Neinstein, from the physician needed to actually make that behavioral change. Data can really change the way that we conduct medicine with our patient populations. And it's the way that we're going to be able to do it and make everyone more effective and efficient as care providers and make patients feel better in a world where we have more patients who need chronic care and we have fewer physicians to actually deliver that.
So I was having a challenge with my numbers at nighttime. I had a conversation with a couple healthcare providers inside our system. They began to query me about what I was eating. What came out was I was eating popcorn, and the popcorn raised my numbers every night. The data changed my view, changed my life. This technology that I use on a daily basis has changed my life in such a way that I can go back to work full time, that I can be a husband full time, and I can be a father full time. And it only gets better from here.
But I will share that his story, in terms of at least his struggle with diabetes, is not unique. So the question I have is, how do we make exceptional stories like Steve's the routine standard of care? And as I was actually thinking about it on the way over, I'm thinking, what I should have put on this slide is, why aren't these stories the routine standard of care? Because if you think about what did we do to change Steve's life? He already had the glucose meter. He was already tracking his readings. The doctor already knew how to view the data, how to read it when it's in the right context. The only thing that we did was integrate the data into the clinical workflow in a way that the physicians and the care teams could actually use the data in a program of care. That's it. And that was the thing that changed Steve's life. And it can change the life of millions of other people living with chronic conditions in the United States today. And so when we think about what are the challenges that we have to implementing programs like this in healthcare, the challenge really comes to healthcare is living today in an extremely fragmented environment. And it makes sense, right? Healthcare, there are certain things in healthcare that are necessarily complex. The human body is not a simple thing, right? The human body is extremely complex. Cardiology and endocrinology and oncology, they all have different specialties. The challenge is that when we go to solve problems that are necessarily addressed by those individual specialties, the view that we take is on the view of those specialties and those specific conditions. We take a very narrow view, and as a result, we implement pilot programs, we implement small projects, we implement point solutions that will solve that one condition. And the challenge is, it's the one condition that the one person in the one department thought would solve it, but it's not the way that someone else in another department, in another place within the same health system would solve it. So we end up with lots of fragmentation. So what we need to do in healthcare is think about things a little bit different, because right now what we have are a sea of failed pilots, we have a sea of point solutions, and we have a sea of workarounds, like what we saw with the endocrinologist, where he was actually going home and logging into his personal computer in order to care for his patient population. Talk about not scalable. In healthcare, what I think we can do is look to the consumer enterprise to learn how to change the healthcare enterprise. So if you look at Uber, and by the way, I want to own, it is super dangerous and probably foolish to talk to a room full of healthcare people about Uber compared to healthcare in terms of complexity. But go with me here. Uber did not set out to solve its problem by creating a new phone for people, right? They also didn't set out to create a new mapping service, a new SMS service, a new email service, a new payments system. What Uber did was they integrated all of these things together to create a comprehensive environment and workflow and elevated the experience above the whole thing. How many of you have used Uber or Lyft in the last just this year so far? Great. Now keep your hand up if you used it. How many of you noticed Google Maps or SendGrid or Twilio or Braintree as payments? Right? We don't see these things. We don't see these things when we're using these apps. And this is what it's like to be a consumer. My background in undergrad, I studied design. The first thing that you learn in design school is that the whole is greater than the sum of its parts. And Uber is much greater than the sum of all of these parts. It is a unified platform that elevates the experience above. So think about, what if we were to engage clinicians in the same way? You know, we talk about patient experience and treating patients as consumers, but you know, we often forget that clinicians are actually consumers too, right? So if you think about the 100,000 physicians or future physicians who are in medical school today who are likely to not practice medicine because they don't want to spend their day clicking mouse buttons and doing process for process sake, it's because this is what they're used to. They're used to being a consumer. They're used to using apps that just work. They're used to just doing things that make sense. And instead, what they come into, and what every physician comes into, is something that looks more like this, right? Fragmented. You've got your EMR data here. You've got your labs. You got your social determinants. You got patient-generated health data. You got digital therapeutics. Some of it's kind of cobbled together in a way that makes sense, but mostly it's just really frustrating to work in. So if we think about this from the consumer enterprise approach, what if we thought about building an abstraction that elevates the clinician experience above all of these different parts to make the whole greater than the sum of its parts? You know, it looks something like this, right? You have the clinical workflow. That's it. That integrates everything, right? The way it works today is that physicians, in their own buffer, in their own memory, have to remember things like, oh, right, I remember that Mrs. Smith told me that she lives really far from a grocery store, so it's actually hard for her to get fresh food, right? But unless that was put into the patient notes in the right way and in a way that's like easily readable, because the patient notes becomes this whole pages long thing, it's going to have to stay remain in memory. One of our solutions integrates, it brings lab data, pulls lab data out of the EHR and displays it on the same graph as the patient-generated health data. And I was showing this to a physician, and he said, wait, could you do the same thing with medication? I said, sure, tell me what you're thinking. He said, well, honestly, if you could just do it with labs and medication, that's a really big thing, because right now, for me, this was his workflow, so don't criticize his workflow here, but in my workflow, the way my health system has it set up, it takes me about 8 to 10 clicks to get to a lab value report for my patient. And then it takes me another 8 clicks out of that to get to the current medication history. And then I have to actually check with the patient to make sure that medication history is correct. And so he's holding that all in his memory as he's providing patient care. Like, this is just unsustainable. Could you imagine if it took you 8 clicks to do anything in Uber? Like, would any of us use it? I mean, I showed up at Logan this morning, I pulled up my app, I pushed a button, the car came 3 minutes later. What in healthcare works that way? And why can't it? Like, why can't we create a workflow like physicians from that mindset where we treat clinicians as consumers and put this into the power of this into their hands? I want to share with you some leading health systems and payers and pharmaceutical companies are already thinking in the right way about this. I want to share a specific story about one of our clients that we're partnering with who is thinking about it in this way. So Kaiser Permanente came to us with a specific challenge around virtual care. They wanted to engage their members in a new way with virtual care using remotely collected data from devices. Now, I'll go into some of the specific challenges that Kaiser Permanente has. One is that Kaiser Permanente has 12 members. They also have 8 very, very distinctive regions, each with their own multiple sets of versions of implementations of Epic. So when Kaiser thinks about rolling out a new program, they can think about it one in 2 ways. They can think about it regionally as a pilot, in which case it will never scale beyond that. Or they can think about nationally as a service that is a tenant to all of the regions that can be scaled out. And this one fell into the latter. So when thinking about scaling something out nationally across Kaiser Permanente, they have to think about, we need a solution that does not address a single disease state, but instead addresses a kind of care delivery. So it's not about diabetes or hypertension or cardiovascular disease or COPD or asthma. It's about the enterprise and how do we create a platform that will enable physicians and clinical staff team members and care managers to work in this solution above all of that. So what we've deployed with Kaiser is in the clinical workflow, there is the ability to create a program that brings in data from patient-generated health data from devices. So Validic connects with over 400 disparate sources from outside the four walls, all objective data. So they can create a new program. They can say, we want to bring in this kind of data, create a program that does this, this, and this, drag and drop, simple interface, and they can roll that out across regions. And the program has been extremely successful. I can go into more details if you'd like later, but let me just tell you about some of the program's success. So after only about a year in existence, the program has over 30,000 members enrolled. There's over 18,000 members being actively monitored with either diabetes or hypertension, which were their first two use cases. For the physicians, 80% of the physicians report that this program saves them time. Think about that. Like, we implemented a program into the guts of Epic. We deployed a solution that it has views in the clinical workflow that helps their care. It's a new workflow for their care management team. We created something where they onboard the patients with a single click, super simple, but we put whole new technology in their system and a whole new workflow, and it saved them time for 80% of the physicians. I felt like that was a huge win. For the patients, from the patient's perspective, the Net Promoter Score was a 54. Now, 54 puts you on track to becoming like as well recognized as some of the greatest brands in the world, like Apple and Southwest Airlines. A 54 is extremely high. I mean, imagine a health system asking you to do something on a regular daily basis, and you have such a positive rating about it that you put it on par with Apple, which is something you have with you in your pocket every single day. It's really impressive. And finally, the other piece about this is that it scales across the whole enterprise in such a way that when they go to add new programs, they don't have to reinvent the wheel. The framework is already there. They just have to bring in new device data, or data from new devices as part of this. So this is what happens when we can engage clinicians as consumers. We can unify the healthcare enterprise. We can create better healthcare outcomes for the patients. We can create better experience for the providers. And frankly, we have to do this because healthcare right now, the way that we're heading, is not a sustainable solution. We have fewer healthcare workers entering the workforce. We have more patients who are sicker. I have two boys, 2 and 5, young. I'm sleeping okay. It's a lot of energy when I get home every day. And they're amazing, but I think about their future and the world that we're growing up in, and frankly, I think about how slow we are sometimes to change in healthcare. And I get nervous because I don't want them to grow up in a world where inertia has caused the healthcare system to cripple, and we end up with a healthcare system that doesn't make any sense, doesn't particularly do great at healthcare, is really good if you're sick, but not particularly good at keeping you healthy. You know, I want to live longer than my parents and my grandparents, and I want my kids to live longer than me. I feel like that's a very normal thing to want. And I'm concerned because the life expectancy in the United States is going the wrong way. And in order to do something about that, we have to change the way we think about this. And in order to change the way we think about this, I think we need to think about healthcare as a consumer enterprise, not just as a healthcare enterprise. Now, I have some really good news. Our friend Steve got a lot better. Just last week, we received an email from Steve that he just hit his lifelong goal for his A1C of 6.0. When we first met Steve, his A1C was 9.5. And he's like, I can't control it. Like, there's nothing I can do. And then he got better, and then he got better, and then he got better. And he emailed and he said, I hit my goal, 6.0. I couldn't believe it. Last time I saw him was in January. He's at 6.5, and I was thrilled. This is a man whose life literally has been transformed because we were able to get the data into the clinical workflow in a meaningful way. At Validic, our mission is to improve the quality of human life by building technology that makes personal data actionable. And I'd love for all of you to join me in that mission, because this is something that affects all of us, and it affects everyone in this country and really the world. And what I truly hope is that we can make exceptional stories like Steve's routine. This can be the normal in healthcare if we think about this in a different way and change our perspectives from pilots to platforms. Thank you.